Today, I'm treating the actual sister of my sister from another mister, YouTuber Sabrina Britton. Hi guys, welcome back to the channel. My name's Dr. Sarah Tonks. I'm a cosmetic doctor in London. Today I am going to be giving a injectables and ultrasound makeover for the sister of YouTuber Sabrina Britton. Here's a picture of our lovely Sabrina right here. And let's go on over and take a look at her sister. So Sabrina's somebody that I've been working with for a while now. And I don't know, can you guys see the family resemblance between them? I think they've definitely got really similar eyes and the lips as well. I mean, maybe not so much now, but definitely when we first met, the lips were very, very similar. And I think the overall shape of the face is similar too. Anyway, so let's concentrate now on our lovely model. What do we do? Well, the first thing that really stands out for me is the skin quality. So she's got a few little milia around the eyes and definitely a little bit of acne in the mid to lower face. Although she's carrying a bit more weight on her face, you can see she's actually got really good cheekbones, which I am very jealous of. And the shape of the face is already very good. So it doesn't really take much in order to kind of improve her overall look. Of course, the thing that she was most interested in having done was lip fillers, because I think everybody is super interested in having that. When I see someone for the first time, there are certain things that I always look for. So I'm always looking at the position of the cheekbone and do they have any volume loss in the front part of the cheek here, right there. For her, things that I noticed were the tail of the brow is a little bit low in comparison with the head of the brow, and you see the way that the angle of the eye is very slightly slanted downwards. There's also a few fine lines and a bit of crepiness around the eye too. The width of the mouth is good. It's definitely the phi of the distance in between the eyes. Although I do think a bit more volume would be good. So let's go over and see exactly what we did. So I started off by doing ultrasound for the full face. Ultrasound is kind of a funny thing. You don't really see a huge amount of difference with it, even after like 4-6 months. Which is the amount of time that the manufacturers would recommend waiting until you assess the results. However, in my opinion, it does give a sufficient difference in order for me to recommend it to a number of my patients. I would only really use it on people who have got a heavier face. So you might be familiar with brand names such as Ulthera or Ultrasound, but there are a whole bunch of different ultrasound machines out there. Ulthera was probably the first one, and that's the one that people still find, you know, it's synonymous with having an ultrasound treatment. On her, I actually used a machine called Ultrasound, which is a Korean device. So you're not going to see the results of the ultrasound. These pictures were taken on the same day. You might get a little bit of edema and swelling in the skin, which can often make it look like, you know, that's going to be the result, but it isn't. It's just because there's more fluid in the tissue. Everything just seems a little bit plumper and tighter and more lifted. So often people will go through this sort of emotional journey when they're having ultrasound done. They get it done and then everything looks fantastic because it's a little bit swollen. Then after about 2 or 3 weeks, it kind of look like you're back to normal. And then it takes months and months and months for you to really get your final results. And obviously during that time, yeah, you were kind of thinking, what the hell? What did I pay all that money for? I don't see a difference. But even so, the results with ultrasound, they are going to be very subtle. What you will see is some skin improvement and also some lifting and tightening as well. I think for me, it's the skin improvement, which is the most interesting. So you often see that the person just looks slightly more luminous after they've had ultrasound treatment. And this is something which I'll do, it depends on the patient, but for example, somebody like her, maybe I would do it every year just to keep on top of things. One of the problems that I see with ultrasound treatment is people getting fat loss. So, you know, there are devices out there which cause cavitation in the fat, which are ultrasound devices. So I guess it's not outside the realms of possibility that the same thing could, in theory, happen on the face, for example. So this is why I mainly use it in patients who do have a fuller face. Because, you know, guys, no treatment is without risk. I mean, you can even get paradoxical fat growth when you have cool sculpting. That's right, the cool sculpting machine, which is used to freeze the fat, in some cases, it can make that area which has been frozen actually become more fat. Kind of weird. Anyway, let's go straight over and talk about what else we did. So we hit the injectables next, and I did some Botox for her in the frown lines, across the forehead, the crow's feet, and we did the lower face too. And I think this is really interesting, actually, in people who do have a little bit more heaviness in the lower part of the face. I often find it's important to treat this muscle here, the mentalis, and the DAO right here as well. So this one is responsible for you kind of puckering your chin when you're talking. And this one is responsible for the downturned corners at the edge of the mouth. Some people really hate having the lower part of their face treated because it does make it feel different when you're smiling or laughing or speaking sometimes. And it just drives some people absolutely crazy. But I love how it looks afterwards. So I think with things like that, honestly, you do get used to it. The more you have it done, if it feels a bit weird at first, it becomes not so weird eventually. Oh, and we also treated the upper part of the platysma right here. So the first thing that I did for her was use some radiesse along the cheekbone. And I used 1.5 mils per side. Radiesse comes in 3 different sizes. 1.5 is the biggest syringe. Now I'm using another technique with Juvederm Vollift. It's 1 mil, and I'm doing tiny little injections in front of the ear to try and restore the volume there. So far we've used a total of 4 mils. Then I used some Juvederm Vollift in the lips. And this is kind of my usual pattern of injection that you're seeing here. So I'm doing the upper vermilion border, which is along the lip line, and then the lower middle third to create more volume in the lower middle third. Then I'm just doing a little bit of tenting in the philtrum, which is this part of the lip just here. Then I'm gonna put some microdoses in the border of the lower lip, just in the middle third. And we finish up with the corners. So when you're doing lips, it's very common to, you know, mix up different techniques in order to get a nice result. So in total for her, we've used 5 mils of filler. That's 3 mils of radiesse and then 2 mils of Juvederm Vollift. And you see, she's just carrying a little bit of extra weight underneath the chin here. I'm gonna go and do some acrylics there. We don't have Kybella or Belkyra or whatever you want to call it, depending on which continent you're on, in the UK. They keep promising it's coming, it's coming, it's coming, but I actually don't think it's going to be here anytime soon. So I'm still using acrylics, which is the same active ingredient. It's the European version. We only have time to do 1 round of this treatment. Typically you will do maybe 2 or 3 for the best results. Okay, so let's go over and have a look at her results. Well, I have to say, I am loving that brow position on her. Look at that. Tail of the brow just looks better. The eyebrow shape is kind of more peaked and lifted. You see that this sadness, which we saw around the eye before, really not there anymore. And you see these tiny little lines and wrinkles underneath. Because we've treated the crow's feet, you often find that because this section of the muscle is relaxed, you may see an improvement underneath the eye as well. I'd say that there's definitely less shadowing underneath the chin here. Looks like the acrylics has definitely done its job, although doing another couple of rounds would have been good. And we've definitely got much more shape, much more of a V-line to the face than beforehand, where we were a little bit round. And for me, I think that's the perfect amount of lip for her. I don't think that I would want to go any bigger. So let's have a look at the sisters side-by-side comparison to see if they look any more similar now. What do you guys think? It's kind of interesting, no? Okay guys, so that's it for this week. I hope you enjoyed the video. Let me know what you think in the comment section below. Let me know if you've seen any of Sabrina's videos. Join me again here next week where I'm going to be doing more of the same. I will see you then.